Doctors are leaving medicine. Why and should you consider it? Hello friends, if you're new here, my name is Malki Assad, a plastic surgery resident in the US, and I'm sure you've heard recently of Ali Abdaal leaving medicine to pursue his career as a YouTuber and as an influencer. And Ali Abdaal is not the first and won't be the last influencer to leave medicine. Kevin Jubal has left plastic surgery training before that. Other doctors have left medicine partially to focus on their entrepreneurial work, and people from all fields change what they do all the time, but we always make so much buzz when somebody leaves medicine. So in this video I'm going to talk about why someone would decide to leave medicine, and this conversation is also helpful for those interested in pursuing medicine to know whether medicine is the right option for them. Ali Abdaal summarized nicely the reasons why someone would work, and these include to make money, have fun, have a purpose in life, to achieve a certain social status, and to help others. So I'm gonna go into these factors one by one and discuss the rationale for staying in medicine versus leaving medicine from each of these factors. And I want to start with money, which is an extremely important factor, if not the most important factor when deciding a career. Because as Ali Abdaal says, if you're working but you're not getting money as a compensation for your work, that would be considered volunteering. So whether we want to admit it or not, money is an important factor when deciding a career or deciding to stay in a career. To isolate the effect of money on your choice of career or whether you want to stay or leave, imagine yourself you win the lottery, let's say $200 million or $1 billion. Would you still do what you're currently doing, or you would be traveling around the world, enjoying food, different cultures, music, theater, art? What would you do if you earn so much money that you don't currently need to get money from your work? You yourself as a doctor, let's assume you win the lottery today. Would you still continue your job as a resident, as a physician, as a surgeon, or you would quit? If the answer is I would stay in medicine, that means money is not an important factor in your decision and you're staying in medicine because of the other factors I'll be talking about. If the answer is I would quit, I wouldn't stay, you have to start thinking about changing your career. Because if the only reason that is keeping you in medicine is money, there might be other ways that make you more money and give you a better lifestyle than medicine. Now going back to our influencers, if you ask Ali Abdaal, if you win the lottery today, $200 million or $1 billion, would you quit your YouTube channel? And with high certainty, I would assume he would say no. I would still do it because he likes doing it for the other factors of why would you work other than money. And again, along the same lines, if you offer these influencers double the salary that they are making in YouTube in medicine, would they stay in medicine? With high certainty, I would assume they would still quit medicine, because the reason why they stayed or they quit is not money, it's the other factors associated with the job. However, not everyone has the luxury that Ali Abdaal had, where you have a side income that is way more than what you're making through medicine. I saw Dr. Cellini commented on Ali Abdaal leaving medicine, saying if he was an attending, making an attending salary in the US, that might be different. Because Ali Abdaal now, as a YouTuber, is probably making multiple times more than what an attending in the US would make. But still, even if you offer him more through medicine, I would still assume that he would leave medicine and pursue YouTube and the things that he is doing, because he's probably enjoying these things more. But after saying all these things about the interplay between medicine and money, I still believe that medicine is one of the very few jobs that can guarantee almost every doctor to be a middle class income, even if you're not a great doctor. On the other side, in business or in tech, if you're not really good, you won't be making good income. But in medicine, almost every doctor makes good income, and those who are really good makes a lot of money. So if you're listening to this video and you're considering medicine and you're not sure about your financial future with medicine, generally for the last so many years, doctors have been making good money to support a good lifestyle around the world, not only in the US or in Europe, but around the world. But if your dream is to become ultra rich, medicine is probably not the pathway for that. Now moving on to the second reason why someone would work, which is because it's fun. And for me, that is the most important reason why I would pursue a certain career versus another. Because I enjoy it, it just fits my personality. I have so much fun when I'm doing my job. And this should be one of the most important reasons why you should pursue a career, because you're going to be spending so many years doing the same thing. So at least you should be having fun, so you won't be miserable throughout your career years. But how can you know whether you like something? You have to try it. So if you're interested in pursuing medicine, you can go and shadow a doctor. If you're interested in pursuing surgery, maybe go to the operating room and see how they're doing things. The problem though is sometimes things look different on the other side. So if you're a student watching a doctor, you might say, oh my gosh, this is amazing. But after you start actually doing it, things might change. The same for the operating room. So if you're watching a surgery, things might look different when you're a resident, retracting, helping with suturing, helping with the surgery, versus a surgeon who's actually holding all the stress of the surgery, making the decisions. So you have to be very careful when you're observing. It might not look the same as if you're actually doing it. Or you might like it for a day, two, a year or two, but after 5 years, 10 years, you might not find yourself in that job. That's why it's actually very tricky to decide whether this job will be fun for the rest of your life. And when you listen to influencers who leave medicine, you might hear some of them saying, I didn't enjoy taking care of patients, or taking care of patients was fun, but I enjoyed the other things more. But if you look at the different specialties after you finish medical school, there are so many specialties, actually not so many, a few specialties in which you don't have any interactions with patients. For example, in pathology, you don't see patients. In radiology, you don't see patients. Surgery, you take care of patients, but in a different perspective. So not all specialties after medicine you actually have to take care of patients or enjoy taking care of patients. So maybe now as a med student or as an intern, you're not enjoying the task that you have, but as you grow more within the specialty, you will start loving it. You have to look at the end product. This is a good advice my friend gave me, is do you like the end product? So what is the end product of a surgery resident is the surgeon. So look at your surgeons and see, do you want to be like them? Do you want to have their lifestyle? If you're a dermatologist, do you like the end product of a dermatologist? If you're an internal medicine doctor and you're deciding between the subspecialties of IM, look at the end product of each of these subspecialties and see whether you see yourself into it. So if you're not enjoying your job now, that is totally fine, especially as a resident. But if you graduate and you're still not enjoying your job, or if you're a resident looking at your role models and you still don't want to do what they're doing, here you have to start thinking about changing your career. Another factor that plays a role into whether I'm having fun doing what I'm doing is lifestyle. Lifestyle is an extremely important factor in deciding how much you're enjoying your job. Otherwise, it would lead to burnout. And I see many students, they don't care about lifestyle when they choose a specialty. They say, I want to go to the toughest specialty, I love it. But once they actually start doing it, working so many hours a day, they barely have time to do anything outside that specialty, they will start reconsider their career choice. So also keep that in mind when you're choosing a specialty, and think you shouldn't be leaving medicine if lifestyle is the problem, because there are so many specialties and subspecialties that are easier than others. So the lifestyle of a dermatologist is easier than the lifestyle of a neurosurgeon. The lifestyle of an endocrine surgeon might be easier than the lifestyle of a trauma surgeon. So even within the same specialty, there might be subspecialties that are easier than others, lifestyle-wise, not surgery-wise. These surgeries might be even more complicated, but I'm talking about the number of hours required, and that changes from a country to another. The lifestyle of a neurosurgeon in one country might be easier than the lifestyle of an endocrine surgeon somewhere else. So just think of all these factors, and my advice to you is don't leave medicine if lifestyle is the problem. There are specialties and subspecialties that offer you a good lifestyle and good balance between your work and your family and research or any other endeavor you want to pursue. And also remember, within medicine, there are opportunities other than just patient care. So if you're an internal medicine doctor, you don't have to spend 100% of your time taking care of patients. You could be spending 40% of your time taking care of patients, 30% doing research, certain percentage doing education, working with medical students. So that's what's beautiful about medicine, is that you have so many opportunities besides patient care. Now let's move on to the third factor, which is helping people. In my opinion, helping people is not a big component of choosing a job. Because in my opinion, every job helps people in a certain aspect. If you're working in a bank, you're helping people. If you're a doctor, you're helping people. If you're a computer scientist, you're helping people in a different way. And doctors sometimes believe that they are helping people to a larger extent than other professions. And I totally disagree with that. I disagree with the fact that doctors help people more than engineers or more than computer scientists or people in tech. Everyone in the society has their own way of helping people. Although doctors have this immediate impact on patient health, I disagree with the fact that they are helping people more than others. And if you leave medicine, trust me, there are so many doctors who filled your position. So helping people should not be the only reason why you're pursuing medicine, or not leaving medicine. The fourth reason is meaning or purpose in life. What do you want to achieve in your life? What impact do you want to leave on the world? What do you want people to remember you by? And this is, in my opinion, a very important factor when it comes to deciding to stay in medicine or pursue in medicine. If you want to be remembered by the number of surgeries that you did, perfect, then surgery is the path for you. If you want to be remembered by the smiles you see on patient faces, by the people who talk how many patients you helped, that is totally fine. If you want to be remembered by the impact you leave on people through education, maybe Ali Abdaal's decision is right then, because he would be leaving way more impact through his YouTube channel rather than by taking care of patients. So you have to ask yourself, what is the purpose of your life? Why are you working? What type of impact you want to leave on the world? And that will help you decide whether medicine is the right option for you, whether you want to stay or you leave. Whether you want to admit it or not, whether you want to agree or disagree, doctors have high social status around the world. When I was in Syria, I thought that doctors have high social status only in Syria or in the Arab world, but not in Europe or in the US, and that is not right. Doctors have high social status in the US and in Europe, and from what I've heard from my interactions with IMGs around the world. And I don't think that will change anytime in the future because of the nature of a doctor's job, which is healing patients. And again, if you agree or disagree, admit it or not, consciously or subconsciously, people pursue high status jobs. If they offer someone the same exact job with same salary, one with high social status, one with lower social status, you will probably pick the one with the high social status. So that could be one of the reasons why someone would pursue medicine or even stay in medicine. Ali Abdaal brought a very important point that when he was considering leaving medicine, he was afraid of what people would think. Now I'm not a doctor anymore, so the social status would come down. Although social status is important, in my opinion, it should not be the sole reason why you're still in medicine. If you achieved meaning in life, helping others, money and fun through another job, social status should not be the reason why you're still in medicine, because you don't want to be miserable to have a high social status. And also remember, medicine is not the only way to get a high social status. You can be a CEO of a company and have a high social status. You can be an engineer and have a high social status. You can have a high social status within any job. So don't stay within this bubble that tells you medicine is the only way to achieve your high social status or for people to believe that you are important. Your accomplishments will decide whether you have contributed to humanity and life, not necessarily you being a doctor. So now you can go and apply these 5 factors we talked about on Ali Abdaal's situation or Kevin Jubal or any person around you who left medicine. These people are making more money through their side job than through medicine. These people are probably enjoying these jobs more than they enjoy their time on medicine. And Kevin Jubal mentioned that in his video when he talked about, he had a sheet where he says, I want to do plastic surgery versus the entrepreneurial work that he has. And every single day he was choosing not plastic surgery, the entrepreneurial work. And I'm sure the same applied for Ali Abdaal. So if you enjoy your work, the other work, more than what you enjoy medicine, I think that is a valid reason for you to leave. If you still enjoy medicine more than the other job, probably you should stay. Because in my opinion, the most important factor that should keep you in a job is the fun. Are you having fun? Are you enjoying it? Because money will come through medicine, through another job, maybe more here, maybe more there. But the main question that you should ask yourself is, are you having fun? Going to the third factor, they're helping people through their YouTube channel, through their companies that they have. So this is not a factor for them to stay in medicine. The meaning or purpose in life, that is a question for themselves. But I'm sure if they left medicine for that, they're probably finding more meaning of their life in that job compared to medicine. And finally, the social status. I'm sure being an influencer with over 1 million subscribers on YouTube and having people reach out to you for questions, having people listen to you, appreciate your opinion and learn from you, definitely puts you in high social status. Now, before I end this video, I want to answer a simple question which some might ask. Why would someone who is not enjoying medicine, they enjoy the other job more, who is making, let's say, similar money, similar social status, similar meaning in life, and similar helping people, why would these people stay in medicine if they're not enjoying it? Is fear. People are afraid to change their whole career after they spend 10 or 15 years studying for one thing. People are risk aversive. They would say, you know what, I'm not sure what will happen in the other route. Maybe I have money now, but I might lose it in the future. Maybe my YouTube channel dies. Maybe people don't listen to me anymore. Maybe my company goes bankrupt, and they give you a long list of reasons why they're afraid of taking that step. My advice to these people is don't be afraid. Don't be afraid to pursue your dreams. Don't be afraid to change your career, to be having fun through what you're doing. If you want to spend your life miserable doing some things, you have not experienced your life. Life is so short to spend it doing something that you don't like. That brings us to the end of this video. I hope this video can start raising up questions that you need to answer to start shaping your career. Medicine is an amazing job. The satisfaction that you get after helping a patient, after doing a surgery, making an immediate impact on patient is unmeasurable. However, it's not for everyone. Not everyone enjoys that. So you have to start asking yourself these questions that I discussed in this video. Whether you're interested in pursuing medicine, currently a med student, resident, or already an attending. It's never late to start learning, discover your passions, and live your life to the best. If you find any value in this video, make sure to hit the like button, subscribe to the channel, and hit the bell sign so you get notified whenever I post future videos on my YouTube channel. If you're considering changing your career or you have any questions about that, drop them in the comments below, or feel free to reach out to me on Instagram or Twitter at Malki Asad, my Facebook page Malki Asad MD, or our email info@thematchguy.com. Thank you everyone so much for watching, and see you in future videos. Good luck on your career.